This assignment group consists of 3 students from Al-Azhar University in Gaza, Faculty of Dentistry, Introduction to Dentistry, supervision by Dr. Walid Al-Houd. The student names Dr. Ruqya Baba, Dr. Ragad Al-Farra, Dr. Rima Jum'ah. Let's talk about ECC. ECC stands for Early Childhood Caries. Is defined as the presence of one or more decayed, missing, or filled primary teeth in children under 6 years of age. ECC is one of the most common chronic childhood diseases and has a significant impact on child's general health, including nutrition, growth, speed development, sleep quality, and overall quality of life. India reports a high prevalence of ECC compared to many other countries, particularly low and middle income countries. Several factors contribute to the high prevalence of ECC in India, including limited parental awarenesses, poor access to dental care, unhealthy dietary habits rich in sugars, and prolonged bottle feeding practices. The DMFT index, decayed, missing, and filled teeth, is a globally accepted tool for assessing dental caries in primary teeth and allows comparison between populations. Previous studies conducted in India reported wide variation in ECC prevalence, highlighting the need for a systematic review and meta-analysis to provide more accurate and reliable estimates.
The high prevalence of ACC in India can be explained by socio-economic factors, cultural feeding practices, poor oral health awareness, and limited preventive dental services. Gender differences may be related to variation in feeding habits, oral hygiene practice, and caregiving behaviors. When compared to international studies, similar prevalence rates were observed in countries with comparable economic conditions, while lower rates were reported in high-income countries. Frequent sugar consumption and inadequate oral hygiene practices play a major role in the development of ACC. Challenges such as limited access to dental care, especially in rural areas, and high treatment costs contribute to the persistence of the problem. The study highlights the need for preventive strategies and improved public health policies.
A systematic electronic search was conducted in the PubMed Medline and Scopus databases in October 2020, using specific keywords related to early childhood caries and the Indian population. Filters were applied to include only epidemiological studies that assessed the prevalence of ECC among children under 6 years old in various geographic regions of India. Studies were selected based on predefined inclusion and exclusion criteria, focusing on cross-sectional surveys and observational studies. The quality of each study was evaluated by assessing the risk of bias through standardized tools to ensure reliability and validity of the data. Data extraction involved collecting information on participant demographics such as gender and geographic location, as well as feeding habits and DMFT values. 2 independent reviewers conducted the selection, extraction, and the quality assessment processes, with a third reviewer resolving any discrepancies. A meta-analysis was performed to calculate pooled prevalence rates and mean DMFT values. This quantitative synthesis is crucial for combining results from multiple studies, providing a more accurate and comprehensive estimate of ECC prevalence in the Indian population.
I'm Ragad Al-Farra. I will talk about the results of prevalence of early childhood caries in India. A large number of studies conducted across different regions of India were included in the analysis involving a substantial number of children. The bold results showed high overall prevalence of early childhood caries among Indian children. Differences in ECC prevalence were observed between males and female with slight predominances in one gender. Significant geographical variation was noted with some regions reporting higher prevalence rates than others. The mean DMFT index was relatively high, indicating a considerable burden of untreated dental caries. This finding reflects a significant public health burden related to ECC in India. Conclusion: early childhood caries represent a major public health problem in India. There is a strong need for early prevention and parental education to reduce ECC prevalence. Improving access to dental care service, particularly in underserved areas, is essential. Continued research and monitoring are required to assess the effectiveness of preventive intervention. National oral health programs based on scientific evidence are necessary to reduce the burden of ECC.